Hi, and welcome back to the Tooth Doctor here on YouTube. Thanks for joining us today. We're here with Dr. Peter Yoo, the Tooth Doctor.
Hi.
And today we're going to be talking about dental implant complications, because we know there's always going to be something, right, down the road, maybe for some person out there. Eleanor Roosevelt says, "Yesterday is history, tomorrow is a mystery, today is a gift. That's why we call it the present."
Very
Love
true.
that quote. The long-term failure rate of dental implants is generally 5 to 10%, and that's Giorgio Tabanella from, I don't even know where that is, someplace in the world. I can't even say all those names. That's actually a really good, like a really low failure rate, is it not?
5-10%, that's not bad.
It's not
you
bad.
know? And again, it really just depends on the clinician. You know, I've heard of certain situations where it's more, and I've heard situations where it's very, very minimal.
Oh, nice.
Yes.
Okay. Well, do you have any stories you could share about any complications with dental implants you might have seen or heard?
You know, when I was first getting into doing implants, my mentor that taught me showed me a lot of things, and showed me placing implants. It was great. It was awesome. It was wonderful. I was like, man, I want to do this.
Mm-hmm.
And then I went to a course with the complications of implants, where a surgeon was showing a bunch of things that came about and arose from improper planning, patients not going in on a regular basis, and it was scary.
Mm-hmm.
There are things that something breaking in your mouth. That's not fun.
No.
So when you see and hear things and see situations of implants not doing well, it scared me. But it made me also think about being more critical and being more on top of things when we do our treatments, so that everything is done well. We don't want to compromise the situation for someone, so that we don't want complications. So
No.
I don't see any complications. The surgeons tend to deal with a lot of these complications in the city, and we hope we never have one.
Yeah.
Yeah.
That's preventative. So what is the most common reason for infections at the implant site?
One of the most common things they said before was implant cement. Okay.
Oh.
So people are like, what? There are two types of implant crowns. When you have an implant, there's three pieces: an implant, and there's an abutment, okay, a piece that connects to the implant, and then you have the crown on top. Okay. Now sometimes the abutment and the crown is kind of one piece. Okay, it's one piece, and then it goes into the implant.
Okay.
Now sometimes there are, in the world there's two types of crowns. Okay, there's a screw retained crown, and there's a cement retained crown. Okay, so those three pieces I talked about. A cement retained crown is where you have the implant, you put the abutment on, and then you glue the crown on top.
Okay.
Okay, and you have to put in a certain type of glue. There are various implant type cements that are very strong, but still a little bit softer, where you could potentially pop the crown off if necessary.
Oh, okay.
There are situations. I place almost all my implants I place with screw retained crowns. Okay, and I'll get into that later. But getting back to the cement retained crown, when you put the cement in, some of the cement will ooze out from the edges,
Right.
and we obviously want to clean that up.
Yeah.
But there are many times that cement will get down and it'll actually sink in underneath the gums, and you don't know.
Right.
You can't necessarily feel it, and what ends up happening is it damages the bone around it.
Oh, wow. Okay.
Okay.
So what are some of the steps you take to prevent the infections pre-op? So before they get that bad, what do you do to? So what are some of the steps to prevent infections?
Well, before placing the implant, we always want to make sure a patient has good hygiene.
Right.
Okay, so getting scaling, getting the tartar away, make sure there's minimal bacteria in your mouth. We give rinses and things like that.
Okay.
But we want to make sure that the pockets of the teeth and the gums are healthy, so that we know, okay, this patient is a good candidate. Their oral health is good, and so placing the implant, we know that the gum tissue will heal better, heal properly. I don't know, from my recollection, I have never placed an implant on someone who has smoked. Okay, smoking is a very, very serious issue that affects the healing of the tissue in the bone around implant, and so the success rate for placing the implant on a smoker drops drastically.
Oh wow.
Yeah. So there are things, and so there's things like that, somebody's medical history or somebody's lifestyle situation that we have to be concerned about. We have to talk about that so that we want to get the best. Once the implant's in there, the bone is healed around it, everything is healed. You know what? You want to smoke, you smoke. I'm not condoning it. I'm not saying you should or you shouldn't. What I'm saying is once that implant's healed, it is okay. But it's the healing process, right?
Right. Okay.
Yeah.
So, maybe you've already answered this, but what do you recommend to your implant patients to prevent infection?
Well, just proper hygiene, maintenance. Using mouthwash is very helpful to get underneath the gums to reduce the bacteria content in your mouth. Okay. But again, there are many, many people I still see, even in their 50s, 60s, that still brush once a day. And some of them are lucky that they don't get cavities and things like that. But we do, get concerned with just the general health and the healing if we place an implant, if they're not brushing properly or just good maintenance. And again, just coming in every 6 months to make sure that everything is healed properly. We do have steps ourselves. Once we do an implant for a patient, we want to see them a certain amount of times and certain periods of times so that we can check and make sure that it's healing. I've seen many, many people. I place an implant and a week later I see them and I'm like, why is there all this food and gunk all over their implant? Like, oh, I don't want to brush it because I didn't want to damage the gums. I'm like, no, you have to keep it clean so the gums can heal.
Okay. Yeah, important to come in then. So how can bone loss affect a dental implant?
Bone loss can affect it. Well, you know what? You think of a dental implant like a screw. Okay, so you see all the threads that are on there. Okay, so what happens is that if you have an implant and you have bone covering it, and as the bone starts to shrink away, it'll expose the threads. Okay, and then the situation is that the threads, they're much, much harder to clean, much harder to maintain, and so and a lot of food and germs and bacteria can trap onto those areas, which increases more bone loss.
Okay. Okay, you already mentioned this, but let's just take it a step further. Can smoking and poorly controlled diabetes cause issues with an implant? We already heard your...
I can't say enough, like I know friends and family that have diabetes, people that smoke, but those are things that affect healing. So if you want something to heal properly, you have to prevent all that, right? You got to eat the right things. It's like, oh, I want to have good teeth, but I want to eat candy every day. There are many things that are counterproductive, and smoking is one of those things. Uncontrolled diabetes really affects the healing of many things in your body, and so placing an implant, in my mind, would be a no-no. Maybe some other dentists would be fine with it because they've had experiences with that, but I feel the success rate really drops down, and I want the implant to be completely covered with the bone. I want that tooth to be healed. I want it to look natural, and those are my concerns.
Okay. What can cause a dental implant to come loose?
A dental implant can come loose. A lot of times it's because of the bite. Okay. So usually when you're biting and you're putting too much pressure, that way can cause the implant to loosen up. I like to use the example of cars. It's here in Edmonton we have 2 seasons. Okay. Summer and winter. So a lot of people have winter tires. So let's say you change your summer tires to your winter tires. Okay, and the mechanic or the shop that puts your tires on, they torque the bolts. Okay, they actually tell you after you've driven for about 100 kilometers, you need to go back and they need to recheck it to make sure that the bolts are nice and tight and haven't loosened up. Okay, same thing with implants. The screws can over time loosen up, and sometimes you have to come in. I've had a handful of people that have done that, and again, because we use screw retain crowns, we can go in, unscrew, check, make sure, clean the area, put it back on, screw it tight again, and it's back to normal.
Nice.
Very quick.
Great. So then how do you treat a loose dental implant? You kind of already answered it, didn't you?
Yeah,
You
basically
check it out and then...
So when you see a tooth implant crown, you'll see a little hole, okay? And we place the screw in there, and then what we do to cover the hole is we put a little white filling to cover it up. So you'll see kind of this situation where it looks like that, okay? Whereas the implant and the tooth, and then if we ever see that screw is loose, we can just drill out the white filling, no freezing, nothing, and basically just take it out. There's usually a little piece of cotton that we place or something to separate that filling from the screw so we don't damage the screw. And then we can go in, pull out the cotton, look in there, get the screw, unscrew it, and then tighten it back on. I always unscrew it to make sure everything is good, make sure there's nothing that got trapped underneath there. And then once I know it's clean, place it back on, screw it tight, take an x-ray so that we know we got the tooth in the right position, and yeah, then it's all good.
Nice. How do you determine if a patient is a good candidate for an implant?
Well, we look at their history, their medical history. We take some x-rays and impressions to see kind of what's going on. If their bite is okay, if there's enough space to place a tooth. They may have the space here, but let's say there's a tooth that's literally touching the gums. Well, you can't place an implant. You'd have to go in and do other things. You probably have to see get some sort of, we call it full mouth reconstruction, where they would have to go in and get everything dealt with so that they have the right positioning of the teeth to get the implant done.
Okay. When a patient doesn't have sufficient bone density, or if they have gum disease, is it possible to fix those problems so an implant can be used?
Yes. With bone density and bone deficiency, with your I would refer them to their medical doctor to see if they need to take calcium supplements, various things to give the strength back to the bone, to get them healing. There's many women with osteoporosis, so those are things that we take in consideration when we're placing an implant, or how long. Sometimes we want to wait longer for the bone to heal around the implant before we go in and place a tooth there, things like that.
Okay. And how can someone get started with the tooth doctor then?
You know what? Give us a call. I've seen many people where they're like, what does it cost? Can I do it? Can I not? What would I need? So we ask people, hey, if you're interested and you have questions, feel free to call us. We can have you come in for a free consultation. We can have a look around, see what's going on, give our thoughts in terms of, if this is a good situation, not so good. Maybe we need to send you to a specialist or someone who, they deal a lot with implants, and then they can, sometimes give you a better understanding of your concerns. If it's a little bit more tricky case, we do cases where we know that everything is going to be successful. So, I would love to do implants for everyone and every person, but when I know that there are situations where it's a little bit trickier and I'm concerned about it being successful, I do have colleagues that I know that are very knowledgeable of the situation. But come and see us. We want to have a look and help you out and give you best understanding in terms of your cost, your options, how long it will take, how treatment will be, things like that.
Sounds good.
Yeah.
Thanks for joining us today here at the Tooth Doctor on YouTube, and don't forget to subscribe to the channel, like the video, give it a thumbs up, and thanks for joining us. Bye.